I think we can do it, right, Julie?
Yep. Had
Okay. All set? Okay. I think everybody's here, and we can open up the first meeting of the Health and Human Services Committee for 2022. We don't have any appointments for today, but we do have minutes to approve. And right now, there's, I believe, 18 resolutions on for this month. I did end up pulling HH 15. We can discuss that when we get into the mental health section. But could I get a motion for the approval of the December 6th minutes?
no, you can get
Second? All right, thank you. Thank you very much. As I said, we have a packed agenda tonight. We have 2 resolutions for Office for the Aging. There's 3 resolutions for the Public Health Department, 7 resolutions for DSS, and now there's 6 resolutions under mental health. I guess we could start with Brenda, and we can get through your 2 resolutions. If you want to come up, Brenda, towards the owl, I guess. We can talk about the 2 resolutions you have on for tonight. I'm not going to group any together. I think this is an opportunity for the departments to go over the resolutions and get a motion, a second, and then we can have questions and conduct the vote.
So the first resolution that I have is the OFA accept the meal proposal. This is fairly routine. We always have a contractor who provides our meals, and RFP went out in 2020 for 21 and 22. So this vendor wants to extend the contract. So this is a resolution for that to happen. Questions? We did do a survey with every year survey all the participants in our meal program, both the congregate setting and the ones that receive their meals home delivered, and they really love the meals through this vendor. Sometimes Meals on Wheels have not the best reputation. We've been through that in years past, but for the most part, people really like these meals, so we're happy to stay with this vendor.
Can I get a motion for HH1? Okay, second?
second.
Okay, any questions about this? I know Brenda, you spoke at the Office for the Advisory meeting that, this is a little bit of an increase or 40-cent increase in your meals based on,
Styrofoam ban, wages, food.
but you're happy with this vendor and you put this in the budget? And
We had the lowest bid, they had the lowest bid at the time
Right.
previously, so.
Okay. All in favor of this extension?
Aye.
Any opposed? Great, thank you. If you want to go over HH2?
So this is somewhat of a related resolution, and this is a new to us resolution, but it's used with several other counties' Office for the Aging programs. Capacity for the Meals on Wheels, the number of seniors that are growing in the community, the number of people trying to utilize our program is growing. As you may know, that our program is based entirely on volunteers to deliver all the meals. Currently, we have close to 80 volunteers delivering routes, hot meals 5 days a week on, I think it's 15 or 16 routes, which is a big increase from a few years ago. As it continues to grow, we end up with these growing pains where we have 5 people that need meals on 6 different routes. We have meal containers to hold the meals, and it's just a number of factors trying to get volunteers, meal containers, the route set up. And so as a part of that process, we end up with people on a waiting list for anywhere from 2 weeks, sometimes 8 weeks, depending on the route. Some routes are heavier than others. This contract allows us to contract with a provider who's willing to deliver 10 frozen meals to the individuals every 2 weeks until we're able to put them on one of our hot meal routes. So this will be something new that we're trying to address that waiting list, so we don't have people getting nothing. We'll give them this is an intro.
Get a motion for HH2? I'll move it. In a second?
Thank you.
Okay. Great. The only question I had, Brenda, this obviously is covered by this unmet need grant. The rest of it was the Arise. A lot of it was.
Most of it was for the grants.
But you're paying up to $14,000 based on a per cost of a meal, is that how it?
Right, until that's exhausted, we'll just use it until that is exhausted.
And you think it'll last for,
It should pretty well cover at least 9 months or more.
What is the waiting list typically like?
At least 5, 4 to 5, sometimes as high as 8 or 10, depending. Yeah, we've done a lot of expansion. We just recently we just added another route with another person who would come and pick up the meals and the delivery. And every time we do that, the waiting list goes down, but then it gradually starts sneaking up again. And I think we're just going to keep seeing that.
and your unmet need funding lasts more than just till the end of this year? So if it didn't use it all, you could roll it?
It's state funding. We can't roll it, but we do
Okay.
anticipate it being renewed every year. It has been for several years.
Okay.
So I talked with the state, with the director, and it's indicated it should be a recurring.
We can, have a motion in a second. All in favor of using this money for that purpose? Any opposed? Great, thank you. Do you have anything you want to add to your report? Thank you very much. Anyone around? Oh, hi, Kathleen. Don't see anyone. Come on up.
Elaine, could I just ask who made the motion on HH1? I have Heidi Nightingale for a second, but I didn't catch who made the initial motion for HH1.
Bob Shea?
Okay, thank you very much.
Maybe when you make a motion in a second, you can say your name for 4 minutes. Okay. Hi Kathleen, if you want to start with the resolutions, we can get through those 3.
I'm glad to do that. And I am going to leave my mask on because I did have COVID, so I'm still technically in my isolation recuperation period. So they are all the resolutions I brought forward are requests to fill vacancies and positions that were included within our 2022 budget. The first one is to create and fill public health assistant position. We previously had tried for quite some time to fill a principal typist position that the list had expired. We did get someone to take the position. It didn't work out for them, for us, given the type of work. This will allow us actually quite a bit more flexibility in the type of work that we can ask this role to do. In this particular role, we anticipate functioning in our environmental health division primarily. The next request is to fill an early intervention service coordinator part-time. We have a tremendous caseload. This early intervention, as many of you are aware, is a mandatory service for children and families with developmental delays. So our service coordinators work to facilitate services for the families that qualify for this opportunity. And the third resolution is a request to create the senior public health assistant position within the health department. We have had, again, not a secret, it's been quite a challenge in particular to fill certain roles, I think throughout the county, but within our health department in particular, with our nursing staff. So we've shifted around every possible duty that doesn't require a nurse, and it could be performed by someone else. We're trying to do so. So by creating this position, we are able to take some of the lead poisoning prevention mandatory work and ask this role to accomplish this work when it's not requiring an army to intervene. So those are my resolutions.
So if I could get a motion to group together HH 3, 4, and 5, I'll get a motion in a second, and then we'll open it up to any questions anyone has.
Nightingale, I move to bundle HH3, HH4, HH5.
Okay, can I get a second for that? Mike Didio, seconds. Thank you. Does anyone have any questions in regards to any of these 3 resolutions? As Kathleen says, all of these were included within the 2022 budget. Yep.
Thank you. How many of these may have less responsibilities or are essentially necessary because of COVID and the pandemic?
I would say none of them are necessary because of COVID and pandemic. It's the workload that we have as a department of mandatory services. The pandemic adds more work to us, but we've been functioning at below our typical staff level. So
So this is a long-term need.
this is a long term, yes.
Thank you.
Elaine, can I ask one?
Yep.
Yep. Early intervention services, I was just wondering if you could speak a little bit to that in terms of the number of like speech therapists and occupational therapists. I know we've had some shortages in our community.
So thank you for bringing that up. To speak a little bit more, both early intervention is a program for children from birth to age 3, and then preschool special education is another program similar for children age 3 to age 5 before they enter kindergarten. And the purpose is to try and help children with developmental delays attain their maximum abilities. And it's really based, you qualify based on an assessment. And there's a standard deviation. So there's some objective assessment that's performed. And many of the needs that often we see children benefit from are physical therapy, occupational therapy, speech language pathology. Those are the most typical of the services that children receive. There really is a shortage, quite a shortage throughout not just Cayuga County, throughout upstate New York, throughout New York State. And unfortunately, the last year and a half, there's been some delays in some of the children getting their therapist as soon as they had in the past. So in the interim, the service coordinators continue to engage with the families and offer some education and some information while they await their meeting with their therapist and establishing their routine. But that is a big need across the state, but particularly in our more rural counties.
Any other questions on those 3 resolutions? Right, can I get a motion for support? Vote for support? All in favor? Any opposed? Okay, great. You want to give us any?
Sure. So I think first, welcome to those of you who are newer in this role, and welcome to this. I look forward to explaining and working with you more about and learning about some of the functions of our public health department. I think it's really cool, and I think there's a great variety, and it's not always COVID. So that's a plus, right? That's a plus. But right now, you know, and I will try to bring, like, this was a nice opportunity to speak a little bit about early intervention. I'll try to speak a little bit to some of the different divisions at different times, or some of the different programs. I think that's easier to learn, but I also welcome any of you coming down to the health department and meeting people and getting to see some of the services. I would say it's not our typical right now, the way we're functioning because of COVID, which I'll speak just a little bit about here also. One of the big changes in this past week was an adjustment by New York State to the isolation and quarantine time periods. So now isolation is 5 days. If your symptoms are resolving, 5 days in isolation, and 5 days wearing face cover when you interact with people. And the same quarantine. So if you're feeling better, it is no longer it's no longer extended longer than that. But there are exceptions. Congregate settings are an exception, like daycares, jails, nursing facilities. Those are the most common facilities and congregate settings that we work with. Schools are, boy, it's hard, and I know I'm preaching to the choir with some of you who work in schools. It's a real challenge right now, and they're really doing a great job working with us. That is one area with isolation and quarantine that we, as a local health department, continue to work very closely with our schools in this regard. We did transition last Friday to people being able to access isolation and quarantine attestations, is what they're called, online. And that really is to help fill the need that some of the backlog positive cases have presented. Again, probably just about every county in New York now has had to go to something along those lines for precisely these reasons, because of the tremendous numbers of cases currently. One of the things we're hoping to see this week is some updated information from New York State Department of Health that not only can help schools, but may also be some online attestations available by the state. So that remains to be seen. That has not been released yet. I haven't seen any drafts, so more to come on that. We continue to provide vaccinations. There's for all the different age groups. I think you see in our daily situational updates, we often categorize certain vaccination clinics to serve special populations. So for instance, a lot of times we may just do one for 5 to 11-year-olds because they need to be with their guardians, their parents, their guardians. And sometimes it can be a little more unnerving than with older children or adults. Continuing our weekly phone calls with our community partners. Back when things are more intense, we spoke more often. We've been down to once a week right now. That's really great. It's first responders, it's schools, it's the college, it's the hospital. We all get to speak about concerns and issues that are happening. And we also have regular and routine communications with our hospital. Spoke to our special assistants for congregate facilities, as well as our school communities. So that's a kind of a very brief summary of a COVID update for people. And I look forward to talking more about other programs as time goes on. So if there's anything special that you have an interest in, please let me know and I'll bring that forward sooner rather than later.
What's the significance of the attestation you're referring to? It gets the department out of follow-up, or it allows people to disclose themselves and get their paperwork, or I mean.
Yes. So in the past, right, a few days ago, we connected, if you were positive, someone from our office or from the state would call you and say, we received your results. How you doing? Here's what you should do to help reduce the spread. And here are your isolation orders. And you benefited from that because then you had something tangible to give to your employer to say, I'm not faking it. We are not going to get to people. So this attestation is a document stating that you are testing yourself. I tested positive on this date, and I'm following the guidance. My isolation should end on this date, and you sign off on it yourself and give it to your employer. And we expect that more people than that will be very forthright and appropriate with utilizing that. We save the quarantine paper. Yep. Any other questions with Kathleen?
Does that include the home tests that have been given out in terms of positive results?
It does. So we a lot of times get lab confirmed ones through the state database, and we've been accepting positive home tests for people when they've taken a picture with the name, date, etc., and submitted it to us. And we're still continuing to try and load those into the system. So we've got some staff working on entering the backlog of home tests so that people will have it in a record somewhere, in addition to what the picture they took themselves. Because in the laboratory one, that's a state operated, so we know they've always got that to fall back on. But it will be, it gives us a better accounting of submissions. But yes, it's both for laboratory confirmed and home test confirmed.
Just one follow. Now, if that test were to come back negative, do they still need to go be retested before they back to school?
So they don't. So there's little nuances for all of it, right? But if you don't feel well and you test and it's negative, you should feel confident that it's not COVID. The sensitivity of the antigen tests are pretty good. They're not as sensitive as the PCR laboratory tests, but they're still really good. And usually you're more likely to get a false negative than you are to get a false positive with the home test. But if you don't feel well, you shouldn't go to work anyway. There's flu going around, right? There's strep going around, other respiratory things. So we always want to encourage people to seek healthcare if they need it.
They just made a big deal to do about the hospital along with the health department, encouraging people, if you do a home antigen test and it's positive, please don't go to the urgent care to get the PCR, because it's just overwhelming the
Yes.
system, and it's not
And it's
necessary.
not, if you test positive on a home test, you're positive. You're positive. It's just those false negatives that there's a percentage of potential error.
Yeah, sure.
Kathy, everyone companies are to blame for all this lateness for their test coming back. I just want the public to know if somebody's on there from the media, it's certainly not our county that is getting the blame for this, or should get the blame for it.
Yeah, it has been a challenge without question. A lot of the laboratories they're just inundated and overwhelmed. And their turnaround time simply is not as fast as would be ideal. And it has taken more than a few days in some situations for people to get their lab confirmation that's being sent out. And initially, like the testing site in Moravia had those growing pains starting out, it was taking more days than was ideal to get the response back.
I just want the public to know that it's not our county health department that's doing this delay or having this delay.
Correct, right, and it's not our local hospital, it's not.
Has Moravia gotten better? Do you think?
Still 4 to 6 days. I spoke with one of the nurses down there today. They're still telling people at the facility 4 to 6 days for your test results.
And then if it's less good, but they don't want, right?
Right, it is a frustration that the state is aware of, and they're working hard with this contractor to see some improvement there. But that's been, I've heard more wonderful things, and so a real credit to the Moravia Fire Department for stepping up and making their facilities available, because I've heard really great things about the accessibility, and people are so pleased to have something in our county.
Thank you. Christine? Yes. Okay, the first, how about, why don't you go over 6, 7, 8, 9, 10?
Okay.
They're sort of renewal, contract renewals and filling of vacancies, and then we can get a motion for those and get questions.
Okay, very good.
Yep.
HH6 is the department's asking to enter into a contract with Catholic Charities to provide case management services to individuals who receive safety net assistance or TANF. Safety net assistance is for single folks or childless couples. TANF is for families. So when some of these folks are receiving cash benefits from us, the department has a pretty good idea that they might be eligible for SSI, which is a federal social security benefit for people that are disabled. But getting through the process of the application and jumping through all the hoops that's required to actually have the application for SSI approved is complicated and time consuming. And so we have had a contract for a number of years where we have put some focused effort on trying to get people through the process of being approved for SSI. So we're asking to have some money towards the safety net assistance individuals, and then some money, if all this contract goes towards families. TANF. So and the real purpose of this is the faster that we can get people off of the safety net and the TANF, the more money that we'll save the county. So if we can, move that up even, 5, 6, 7 months, instead of having it take years, then that's going to benefit us. So that's the reason for asking for that contract. HH7, we are asking to enter into a contract with Catholic Charities again to provide supervised visitation for clients that we refer. So what this is all about is our children are in foster care. We are required to provide visitation for the families that have had their children revoked. And we like to provide as much visitation as we can, and we like that visitation to be meaningful. The Catholic Charities contract that we have really serves to provide that time for families to have visits with their children. And it also is an educational opportunity for the workers to really help the parents learn and work on skills that we've identified that they need to, Sometimes the visitations can take are given for 2 or 3 hours, multiple times a week, especially with younger children. The more visitation that children have with their parents, the higher the likelihood is that they'll be reunited and the faster that they will be reunited. So we like to try to, get as much visitation going as we can. And this is a contract that will help to provide those services. HH8 is to enter into contracts for daycare services. So we have a federal daycare block grant of about $1.5 million. And families in the county are eligible to receive subsidized daycare if they fall under the income guidelines that are set. And these agencies that are listed on the resolution are the folks that we have worked with that take the children that receive, the families that receive the subsidy for the daycare. And this contract allows us to enter into contract with all of these people listed and also any other folks that might come aboard that would want to provide the service as well. HH9 is asking for the ability to fill 4 full-time caseworker positions in our Children and Family Services division of the department. These are budgeted positions in the 2022 budget. We're down, that's a significant number of caseworkers to be asking to fill. We've been, the folks that have been here last year know that we've been struggling with turnover, high turnover in services, and this is asking to fill yet another group of caseworkers that we have, had resigned due to moving out of the area, one took a job with the state, and we've had 2 that have left to go to another department of town. HH10 is we're asking to fill a human services examiner position in the Department of Social Services. The human services examiners work in our benefits area of public assistance, Medicaid, SNAP. I believe that this position is in the SNAP area. So they work with the families who apply for benefits, determine their eligibility, recertify the benefits. Okay.
Yep. So if someone would make a motion to, for 6, 7, 8, 9, 10, and then we can get a second. And if there's any questions, then we'll open it up to Christine for questions on those. Anyone want to make a motion for those resolutions?
Do you need us a motion to bundle that?
Yeah, certainly do that.
Okay. I motion Christina Fargo to bundle HH 6, 7, 8, 9, and 10.
Like Gilson.
Okay, are there any questions on HH 6, 7, 8, 9, and 10? Renewal contracts, filling of budgeted vacancies? Okay, none? All right, all in favor?
Aye.
Any opposed? Great, thank you. Okay, Christine, if you want to talk about HH 11.
Okay, so HH 11 is asking consideration of the legislature to help to give permission for us to use some of the ARPA money to implement a foster care incentive program. So we have, when children come into foster care, there are different levels of care that they can enter into. The most basic level of foster care is our own county foster boarding homes. So those are families that come to us that go through training and become certified to be able to care for children that are in foster care. They receive the least amount of money to take care of children that are in foster care. And if a child has behaviors that are more challenging, there are higher levels of care that we can seek to place children into. A therapeutic foster home is really the next level, and then from there it's residential. Every step up, becomes more costly. So we have been talking and have always been looking at how can we help our foster parents that we have in-house feel more comfortable taking challenging children? How can we help them feel supported And we stopped using them to the higher levels of care. We just sometimes have foster parents that come to us and then they kind of get recruited by the other agencies that do the therapeutic level of foster homes. And then we've taken all that time to train them, got to know them, and then we lose them to a therapeutic provider. And so we would like to be able to implement this program as a way to incentivize really our foster parents sticking with us and taking challenging children, taking some of the children that are more, I guess their foster parents are more apt to say no to. But we have a hard time placing older teenage children. People are a little bit more hesitant and feel that they have, more behavior challenges and that they're not able to manage them or, feel more uncomfortable with that. So we, the provider that we use right now that helps us with our home finding has worked with other counties and has had good success with this incentive type program where you really, you along the way of certification and along the way when they take children, there's a small monetary compensation to them. The second part of this foster care incentive program is to recognize all of the foster parents who have stuck it out with us through COVID, have really for the last almost 2 years been accepting and welcoming their children into their home with the health concerns that they have had, sometimes taking the children that were sick, not knowing the status, if they were actually COVID positive or not yet. We've had families that have had children that are COVID positive. We have had many of these families had to work out plans to care for children when school was not in session. And they were having to homeschool the foster children, maybe with their own children, make their own kids would work. So we feel that they really stepped up. They provided for the children of the county. And we would like to recognize them by giving them a monetary amount. We said $1,000, for any family that had provided care during the pandemic, they would get $1,000. They would get $1,000 as a way to say, thank you to them. So we one of the proposals that we submitted with the ARPA proposals that we were, that we turned in, this was one of them, and we brought it up again and bringing it to the legislative consideration. We feel like, this is something that we think is important, and we really would like to kick off 2022 with the incentive program for the foster parents. So it's really a two-part. The resolution only has 2 parts to this. The reason that we set $150,000 is we would have about 45 foster parents. I looked at that again. Go ahead, talk to you. About 45 foster parents would get $1,000 each. The rest of the money leaves $105,000. Part of the incentive program is on the annual, the date that a foster parent became certified with the county, they would get an annual payment of $500. So we would use up, with about 45 foster parents, that would use about $22,500 in a year. And then we would have money for the other incentives, which is a little bit harder to estimate what those would be because it depends on how many kids come into foster care and how many kids are 10 years old and over. But I took a guess at it and thought that we would probably spend about $30,000 per year. So this money, if we're able to use this ARPA money in this way, I think that it would give us about 3 years to use the money in this way to help strengthen our foster home program here and really see if this type of incentive program works. And we would have information to gather to see, like, are we having a better time keeping foster parents here? Are we finding that that they are saying yes to certain types of children more than they had before? I think we would have the data to show if this type of a program would work, and if so, then I think we would have to find a way to fund it beyond the ARPA money, beyond wherever that time frame is. So if we got ourselves through 2024, we would have to find a way to fund it in the 2025 budget at full county cost, administrative costs. But it might be worth it if we're able to keep kids at this lower level of foster care. I said at the beginning when I talked about this that the regular foster boarding homes don't make a ton of money to take care of children. They make about around $20-something a day for the most basic level of child that comes into foster care. there are, we pay a little bit more for kids that are special rate that have special needs, but it's still much, much less money than therapeutic. Therapeutic is about $5,000 a month, and residential is probably about $12,000 a month. So anything we can do to try to keep children at a lower level of care will help us to save money. Our foster care costs are extremely expensive, and I think, this would be helpful. And
Thank you. Can I get that's a great explanation, Christine, all the questions around how you're gonna use the money, how long is it gonna last, the fact that if it does work, there's a way to potentially budget for it, even at our own county costs, but could I get someone make a motion for HH 11, and then we get a second, we can have further discussion?
Muldrow.
Okay,
Nightingale second.
okay, you hear that, Max, Brian, and Heidi?
Oh, just unmuting myself. Yes, I did hear that. Thank you.
Is there any questions? Lydia?
Trying to understand the bonus process. How is $1,000 bonus for these 45 parents? First of all, is that a one-time bonus?
Yeah.
And how is that expected to incentivize for either more or better care? What's the return on investment there?
I think, for us, we feel like to say thank you to the foster parents who have stuck it out. I think that, if they know that we are supportive of them, this is what we hear from them is, when they hear a thank you, if that's appreciated, I think that helps them to know that they're valued here. I think anything that we can do to help keep them with Cayuga County is really what I think we should focus on. I think by showing them that we recognize that it's a difficult time for them to take care of these children during COVID, that they, set aside their own concerns and safety, and took in children that they didn't have to. They could have told us no. They could have, stopped fostering. And we actually had some foster parents that did that. And those are actually not in this group. This would be to recognize the foster parents that did step up and did continue to take children for us and really put their own health in jeopardy, their children's health in jeopardy. They had to, figure out a way to provide daycare. Like I said before, so I think that, recognizing them and, just.
They won't get it again.
They won't get it again. I mean, it was just a one-time payment to say thank you for what you did. And I think that, they're regular people just like us. And for us to tell them, like, we do appreciate you, I think they are more apt to stick with us instead of going to another county or to another agency.
Thank you. And are we going, I'm guessing that we have a plan to manage the expectations so that others don't think that this is something that's going to be coming around again?
$1,000.
Yes.
I think if we would send something out to the foster parents to get communication around why we're doing this and then outline the expectation that this is what it's for. It's a one-time.
Thank you.
Welcome.
I have two questions. The $1,000 bonus, is there a specific length of time these parents needed to be fostering children to be eligible for that? And then my other question is, what is going to be our major for success? So you said if this is a successful program, we'll look for funding. Is there a cutoff? Is there a money savings that we know is like this has made it worthwhile?
The first part of your question is like how long would a foster parent have had to take in a child? We didn't have a cutoff of what it has to be that you have a child in your house for 2 months or 3 months or something like that. It really, when we call a foster parent and they take in a child, that child could be there for a couple of days, it could be there for a year, they could stay there forever. So we felt like when we took a look at this, we didn't want to exclude the people that have a child that were there for a short period of time, because when they answered that call and they said yes, they didn't really know how long it was going to be necessarily. And taking a child in for a week that was the kid that was COVID positive, to me is big of an ask of a child that that stayed for a year. Does that make sense?
Yes. Oh, yeah.
And as far as the metric of how are we going to know that this was successful, I think we would look at the statistics that we gather on how long foster parents stay open for us, so we would be able to know that foster parents that came to us in 2021 and 2022, are they still with us in 2024? And we would be able to look at what's our success rate in keeping children that are older in our foster boarding homes, or our regular foster boarding home level. Have we had those kids disrupted, had to move higher? Have we had to go to therapeutic work from the beginning? Because there were none of our own foster homes that would keep those children. We would have that data, and I think that's when we analyze all of that together, that would give us an idea of, did this help?
Thank you.
Thank you, Madam Chair. Did I hear you correctly when you said that this bonus money was for families that were taking in problem foster care, as in elderly, or older children? I either misunderstood you or.
So the $1,000,
Yes.
we would provide to any family that that was open with us and took in children during the time of the pandemic. Any child, doesn't have to be a child that had certain specific behavior concerns or anything like that. Could have been an infant, it could have been a sibling group, could have been a teenager. If they fostered for us, for Cayuga County Department of Social Services as a foster parent during that time of March 2020 to current, they would receive that money.
And this is budget, or this 150,000 will cover, you said, until 2024, correctly?
Through 2024 is my best guess. When I take a look at, how many foster parents we have right now and how much we would use at the beginning for the foster parents that we would give the $1,000 allotment to.
You can't spend ARPA money after 25 anyway, so, I mean, that's how you calculated it, so it would last, you have to commit it, and then you have to spend it by 25, I think, if it's ARPA that we're talking about.
Well, I believe that's correct. In
Yes.
The fact that she is asking for ARPA money.
She is, yes.
And again, is this a one-time thing, or is there plans for 2025 to say, we did this with ARPA money and it was a great program, and we'd like to come and ask for this for a budgetary item down the road? Is that the way I'm thinking, Matt?
Yeah, if I could answer, and you can chime in, Christine, I asked Lynn Marinelli this similar question. What if we find that this was extremely successful in keeping kids in a stable foster home, fostering kids that are older when we didn't have the homes before? What if we decide this is very successful? And she confirmed what I thought is the county could opt in the 2025 budget to budget for a certain amount of money to continue this incentive program. It just wouldn't be reimbursable as a foster care expense, because it's above the rate that we're eligible to pay. But I think what Christine was saying, that we could get the county to potentially budget for it. And if it was successful, it would be a smart investment, even with local dollars, because we're able to get more stable and more kids in this lower level of care. So, I mean, we could continue it, Mark, in 25, the county could, by putting it in the DSS budget, an amount of money that would continue this incentive program. And really the pieces that are the most successful. If you find you're still not getting, a lot of over 10-year-olds. I mean, I asked Christine too, the agency that we contract with, they basically talked to the department about this being a very effective strategy in other counties that they work with. Is that true?
Yes, they approached us and said, this is something, as we're talking about with how we're doing. I mean, we're constantly looking at like, how are we doing? How many homes do we have? How many have we lost? What did we lose them to? So when we're looking at all of that, they see that too. And they have approached us and said, what do you think about this? This is something that we have done in other counties, and it has been well received by the foster parents. It makes them feel more appreciated, but valued, and does help them. If they're on the kind of the fence about doing taking in certain kids, it might just tip them over enough so that they can have experience with taking care of that type of child, and then it becomes easier for them. As they said, it maybe opens the door enough so that it becomes more routine for them. And if that's what it takes is a couple of $100, then it's worth it.
And Chris Petrus has been waiting for, sorry, Chris, You have a question, Chris?
Yeah, thank you, Madam Chair. I appreciate it. I think I got most of my questions ferreted out. But so I guess if I could just ask one question and then just make one caveat real quickly. The first question being, what is the total ask of the ARPA funds through 2024?
The total ask is $150,000.
Okay. And I guess I just wanted to remind everyone that the ARPA funds is a limited pool, and I'm not commenting on whether this is a good or a bad. Honestly, it seems like a good, well thought out plan, but I do want to raise the caveat that there are competing interests. There are going to be several different programs and departments that come forward asking for funds. So take that into consideration when reviewing all this. Thank you.
So,
Okay, Heidi, and then.
oh, I'm sorry.
Heidi, go ahead.
So as I understand it, if you had just one child who had to graduate to therapeutic foster care, basically just for that one child, you're paying $46,000 more a year. And that's because you mentioned it's $1,200 for a typical, the lowest level of foster care that you're incentivizing. But if a child has to go into therapeutic, it's $5,000 a month. So really, if there were 3 children who were prevented over this 3-year period, we've recouped our money.
Yeah. Correct.
And how many kids do tend to escalate into therapeutic?
I looked at our, look at a piece of paper I got, just to handle all the numbers off the top of my head. Right now, we have 95 children in foster care. This is in December. 95 children in foster care. 26 of them were in therapeutic foster care level. We had 51 in regular foster home level care, and 8 in residential. So residential is our highest cost, most intensive level of care for children. Therapeutic is step down from that, and then our regular foster boarding homes are at what we're talking about right there. Those are the families that we were talking about, those 51 children that are in that lower level of foster boarding home care.
Thank you. Could you repeat the number in the therapeutic, please?
26.
Thank you.
So I think, in the coming 2 years, if you guys fund this in the coming 2 years, and the department generates information that talks about how helpful it's been in terms of reducing, escalating placements and all that. I think that you can write this incentive into the foster care recruiting contract that you have with Children's Conference and fund it that way. This will be a claimable preventive contract cost of 62% rather than adding it to the rate, trying to add it to the rate, you know what I mean? And that would, OCFS would be
So
fine with
build
that.
it into theirs and
Yes.
then it's reimbursable.
Exactly.
Okay.
I just was curious of the ones that are in therapeutic care. Do you have an idea of how many of them are in therapeutic because they couldn't get placed in a home, not necessarily because they needed that extra care, but because there wasn't a home for them?
My best guess is probably half. Probably 13 or so.
Because you didn't have a regular foster boarding home
Didn't take
to
them.
take them. So you had to bump them up.
We also lose homes that way too.
Yeah.
Agency boarding homes become therapeutic foster homes
Because they
to
did.
keep the kids, so like keeping them in the level of care that Christine's talking about, really helpful.
Any other questions? Okay, I'm sorry, Lydia.
No, that's fine. How has the list of ARPA funds been maintained? I mean, we talked about $150,000. We're still not certain exactly how much we're getting.
Well, the last I heard from, I thought Lynn, when someone asked a similar question is, we are certain that we have $14.8 million, and you may understand that better. And that to date, Emerson Park, Public Health Response, the restaurant program, the 250 for housing visions, we probably still have 12 million and some odd dollars left out of the 14.8. So we have only committed as a legislature, right, Emerson Park, the restaurants, the 200,000 for public health response,
Sterling.
and, Sterling Nature, the 800,000. So that may be, we might be down to 11,000 now.
11 million.
Excuse me, 11 million.
Extra zero.
Yes, we have some decisions to make on how we're going to be spending this money, and that's probably some of the priorities that I think you're gonna be working on, Dave, sooner than later, to see if we can get some agreement.
Thank you, Madam Chair. I believe the number was reported at 12.7 million was left, and
Before Sterling or after? That's what I don't remember.
I want to say after, but I'm not 100% on that. But I have asked and I was told that we would get a monthly report on that at the ledge.
Okay.
That's what I've asked for. I hope that that's what
And
happens.
Hans could ask at Ways and Means that, maybe you could ask at Ways and Means that we keep a record of the ARPA spending and where we're at. And I know there's proposals, definitely, to Chris's point, there are proposals that are being in the pipeline to be funded, so. But the decision at hand is is there support for this resolution? We have a motion and second. Okay.
Madam Chair, I'm sorry, I have another
Sorry.
question. Would it make sense to hold on any request for ARPA funds? And this isn't a recommendation, this is something that I'm essentially just asking, until we have a full list of how we want to spend the remainder of those funds?
I can't speak for the legislature, but certainly I'm hoping we'll all be alive by the time we get a full list. I mean, it's a lot of work but again, I think I had asked you, Hans, about, at one point there was discussion that we shouldn't be approving much of this until we know all of it. And I don't know how realistic, I don't know what the body feels about holding off on any ARPA spending until we know exactly all of what we're going to spend. I don't know how people feel about that. Yep. I don't know how you feel about that.
Well, I think this is one of the most important things that we do, is take care of our kids, and we have families that will take care of their kids, so I agree with Lydia, we gotta certainly watch what we're doing, but in cases like this, I think the 150,000 is well, in my opinion.
Madam Chair, I think that also the fact what legislator Nightingale brought up, that there could potentially be a savings long-term and incentivizing this, and we'll also have a gauge to measure our success moving forward. So this gives us twofold. It gives us a something to measure, see if it's successful,
Yeah.
and also potential savings. And long-term, that could be a savings for the county.
I agree with Ray, instead of just budgeting for it and having it be an unreimbursable cost, allow our contract agency to pass that through and get some reimbursement on it as a preventive contract. So, okay. Did we get a motion in a second, Max? We've been talking about this for a while.
Let me just unmute myself. Yes, I have a motion by Muldrow, a second by Nightingale.
If there's no other questions, can we get a vote? All in favor of using 150,000 of ARPA funds for this purpose, retro and incentive program for foster care? All in favor? Aye. Any opposed? Okay, last but not least. the
Was there
adjustment
anybody opposed to that measure?
Don't believe so, Max.
Thank you.
Last one for me, HH 12. We are looking to provide a salary adjustment for the seasonal heat clerks that we have that work for the department. Heat is the heating energy assistance program that is a big help for folks with their heating costs. We have 4 seasonal heat clerks that we hire each year to help with managing the volumes of people that come in and applications that come in for assistance for the heat program. And the folks that we have working for us, that position has not had any sort of salary adjustment since 2016, we discovered recently. And so we're asking, they make $17.34 an hour right now. And so we're asking for them to be brought up to the $19.79 an hour, which is what the compensation plan for the other bargaining members have in part 2, right? Part 1 of the compensation plan. So, I'm sorry. Part 4 is not.
Part 2. And you're second to the last resolve. Part 2.
Second to, oh, I'm sorry, okay, yes, so in place in part 2 of the Cayuga County compensation plan, thank you. Wendy.
Okay, can someone make a motion for HH 12?
Clark, all motion.
Second? Mike Didio, seconds? Okay. Any questions to make the hourly rate adjustment for the heat clerks that haven't had an adjustment in a number of years? Okay, Lydia?
Questions?
Sure.
Thank you. Is this budgeted and what does this look like overall for a total cost? Please?
Is this budgeted? Yeah, we would have to say it in our budget. I mean, it's nominal. It's $2 an hour for these 4 workers. Work 35 hours a week for 6 months out of the year. Which would be $1,000.
So they come on for, and then in 6
Yeah.
months they're off. And,
Yeah, they come on in the fall,
Yeah.
and we stagger them, so they start in the fall and they end in the spring. They work full time through that whole period. They're tremendously helpful. We wouldn't be able to do the work without bringing them on board.
yeah, sure.
I just have a question. Do we run the heat program through CAP?
So we have a contract with CAP to help us with you too. So CAP starts the process. So the people that are in the community that want to apply for heat, that's kind of the gatekeeper for that. And then we still have to review all of the applications. And there's, besides the actual heat that is what people most traditionally know is where it pays for your gas and electric bill, there's also some other components of heat that we do here in-house as well. There's a cooling program where people that have some sort of disability might be able to get help with getting an air conditioner in the summer, furnace repair. So there's quite a bit to the heat program. Right.
What's the, do you have the same employees coming back seasonally? What's the retaining rate of that?
Yeah, so we've had, that's a great question. We've had great luck with having people that already have familiarity with the department come back after they have retired or left employment and they only want to work part-time. So we've had, we've been very fortunate that they, kind of know our computer system and know a lot about the program. So we haven't had to do a lot of like start from scratch training with people in a little while.
Just seems out of place to me. When does this normally be picked up in your budget?
Well, we just, like I said, it was brought to our attention that we had not, they had not been provided a raise because of where they sit in the compensation plan. The other folks that are clerks receive their raise through as bargaining numbers. So they're really doing the same work, but we haven't had them because of where they sit in the compensation plan as seasonal clerks. They were not able to get those raises.
Thank
you.
They were omitted in there,
They were,
really.
it was
Right.
there.
Okay.
It was brought to our attention years after we had to pick up on it.
All right. Okay, can I get who's in favor of HH 12? All in favor? Any opposed? Okay, great. Thank you. Thank you, Christine.
You're welcome.
And, I think before Ray comes up and talks about the mental health resolutions, I went ahead and I did pull, after I spoke to Ray, I did pull HH 15. And that's where there was going to be an ARPA request for $500,000 to continue some of the work of the Healing Community Study, the staffing, 2 full-time, 2 consultants, and $250,000 of program money that might be eligible for as initiatives come forward based on this multiple substances. But I do really think, based on the conversation, we are right in the process of trying to get from Rich the information about the opioid money that's coming into this county. And I initially thought 1.4 million or whatever it was over 18 years would be about 77,000 a year, and where would we be going with this? But Rich is in the process of putting information together. There are at least 2 settlements that he has information on. It appears that they're going to be upfronting some of this opioid money for the first 5 years. So I think there are going to be funds coming into this county in 2022, 23, 24, 25 in varying amounts. Some of it we just get, some has to be applied for. From what Rich told me that there's a portion of it that must go back into preventive services or into service delivery. I just think until we have that clear picture of what we have coming to us, we shouldn't be we should have that information before we make a decision. What part should be ARPA? If any part should be ARPA, should it be just staffing? Will we have, I just think I'd like the information to come forward so that we could have it all as we deliberate a decision about using ARPA funds for staffing, for programming. And, the hope is, I'm not pulling it because I don't support the initiative or the coordinated effort. I just don't think we have all the information we need to make that decision. So I think to Chris's point, it would be a $500,000 ask, and we should have all the information because there are a number of our proposals coming forward. So I just wanted to say that. Thank you.
Hundred and 20th and final Health and Human Services Committee meeting.
Where's the tissues?
Huh?
Where's the tissues?
It's like Bob Seger, the famous final scene.
What's that?
Like Bob Seger, the famous final scene.
So new legislators, I don't know you also. My name is Ray Bizzari. I am the Director of Community Services. So I oversee the Departments of Social Services and Mental Health. So how do you want to, I know we want to talk a little bit about the mobile crisis stuff. Do you want to do the resolution?
Yeah,
first?
let's get through those and
Sure.
then you can talk about what you and the sheriff have been talking about and, the expansion of mobile crisis. So if you want to go through.
Probably do one at a time. Right?
Yeah, go ahead.
So.
HH 13.
Yeah, if you have questions, just interrupt me and ask, because I'm going to talk like you all know what I'm talking about. And if you're new, it's different. And I just do that, which is weird. But I haven't broke myself of that habit. That's going to happen. So this first one here is, so the Central New York Directors Planning Group is 6 directors of community services in the Central New York region, right? So these are the mental health commissioners. Office of Mental Health has been closing down children and adult inpatient psychiatric beds and making that state aid that paid for those beds available to regions to spend. So the Central New York Directors Planning Group is it's a 501c3, right? And the officers are all of the DCSs. The money that funds mobile crisis in the region is that state aid. That state aid used to be managed by, we've been getting it for about 7 years. It's about $700,000, $800,000. It used to be managed by CCSI, which is an organization in Rochester. And they were taking they take a percentage to manage the contract to do the CFR, the Consolidated Fiscal Reporting, right? So we thought that was an awful lot of money to be paying for a contract, for somebody to maintain the contract and everything like that. We could just keep that money and reinvest it in children's and adult services. So I came to the legislature about 5 years ago, and we did a resolution and everything like that for the money to come to Cayuga County. So that state aid, which is not Cayuga County state aid, it's regional state aid, comes to county mental health, and we pay the bills for Central New York Directors Planning Group, and we do the CFR. So we've been doing this for the past 5 years. I think this hit the auditor and the finance director who said you should probably have a resolution saying that you'll accept the money and then disperse it. So it's like a housekeeping sort of thing. There's no Cayuga County dollars committed to this. The contract isn't held by the county, it's held by the Central New York Directors Planning Group. So that's really what it is. If you have any questions about that, I'd be happy to answer them for you.
I asked Ray, why are we passing a resolution? It has no money in it and it has nothing. I'm like, where did this come from? And the explanation was that our new auditor said,
Your folks said.
you gotta have something that allows you to move that money through.
Right. So you new legislators, you don't know me. I'm like the preeminent rule follower here.
Oh,
So I'm really trying to make sure I line all the ducks up before I go.
yeah, right. I'm like, oh.
So it is really just a housekeeping thing and all of that.
Ray, let me ask you a question.
Sure.
You know, this is your last meeting?
This is my last meeting.
Nice meeting you.
Nice meeting you. I wish I could have had a chance to work with all of you. I do, really.
Is these type of decisions, should it be passed on to successor, or is this something like that we have to make today?
Well, we got to start paying the bills in January.
What does the money go for?
So the money funds mobile crisis.
Uh-huh.
It funds an adult respite program, and it funds some children's respite regionally. And then there's like flex funds, right, for like, families that need transportation to go see their kids when they're in respite, or if they're in, sort of get them to
So
treatment.
this money's already sort of committed
It's all committed by the group.
by the regional
By the
planning
regional
group
group.
that you're a member of.
Yeah, all that money is committed that way.
Okay, so it's committed. All right.
Yeah, it's just like, we've been paying it right along. And now they just want the resolution.
Rich?
Yeah, do we get a fee for doing the bookkeeping?
No. I just assume put it into services. We have staff there to do it. It's not that onerous to do.
Mark?
Thank
Oh, I'm sorry, Lydia.
I have two
He's
questions.
on.
Sure.
Ray, is your predecessor, whoever it be, going to be on this board? I
Oh, yeah.
assume you're on.
Yeah,
Automatic?
yeah. She's
Okay.
going to attend the meeting on Friday. I'm going to introduce her and everything.
And do we have an idea of how much money we're talking?
It's about $700,000 pass-through dollars.
Thank you, sir.
That's outside of your regular state aid.
Yeah, it's not county
Okay.
state aid, it's regional.
And it's for Cuba.
It's for Cayuga, Onondaga, Madison,
$700,000
Oswego,
is the total for the
and Portland.
region. You
Yes,
get a
for
portion.
the region, yeah. So they're regional contracts held by the Central New York Directors Planning Group.
The decisions to be made as far as the bill payments and contracts, does that go through the legislature?
Well, those get submitted to Munis and it goes through the regular sort of approval process that payments go through.
But it's not like the state aid that you give us a list of what you're gonna spend it on. This is kind of outside.
It's outside of that. But you see the bills here, they do go through the normal process to get approved. There's where the sticking point is. We're approving this bill to pay without an authorizing resolution is where they landed on this. So
The auditor said,
First time.
how are you paying these
Yeah,
bills? when you
what
have
gives you
nothing?
the authority kind of deal.
Right. Go ahead.
If this is a regional thing, how do we track it regionally? We have other counties.
So that group, right, that meets, we meet twice a month. Office of Mental Health attends the meetings, the agencies that have the contracts, they report. The financial statements are sort of, the financials come in, they're reviewed, they're signed off by us, and then they're submitted for payment. So it's actually a very robust contract management and compliance process that we have there. And the Office of Mental Health is involved in it as well too, so. It's actually really tight. Tighter than most.
Any other, Heidi or Trish?
Ray, I didn't know it was your last meeting. I'm glad I'm here to say goodbye and thank you for your service.
Thank you.
And I enjoyed working with you too. But this contract, I guess, is this an annual allocation that comes through?
Yeah,
So we do this every, it kind of just flows from one year to the next, or?
the money flows from one year to the next from the Office of Mental Health. This is the first time. we did the resolution to allow us to have the state aid come to the county. And now I guess we need to have a resolution to say that we can spend the money. So it'll be, I mean, yeah, it'll probably be an annual thing, or we can do it for 3 years and not have to bring it back, because does take up a lot of time, routine stuff sometimes that takes your time away from other things, frankly.
Unlike Cayuga County's mental health state aid, this is money through this regional group
Yeah,
that filters into Cayuga County. It's been there for years, but we've never seen a resolution for it.
no, just
That's
in the
why it's so
beginning,
confusing.
just in the beginning, when we came to Health and Human Services, and Charlie was on it, and I remember him sitting next to me asking questions about it, where we talked about it and agreed to move it. The reason to move it was to save the $70,000 that was getting paid to CCSI and reinvested in actual services.
Thank you, ma'am. Is there, I mean, I wasn't around by.
I know, yep.
This past, is there any chance that we can see that resolution and have it for either Ways and Means or the actual budget?
Yeah, we can go back and find it for you.
If that's
Sure.
acceptable.
Oh, yeah, I can go find it for you, yeah.
Thank you.
Yep.
Okay, do we have a motion in a second? I don't remember. So can I get a motion for HH 13?
I'll make a motion.
Okay,
Nightingale, second.
okay. All right, all in favor? Aye. Okay, any opposed?
Thank you.
Yes, 14.
So in the 2022 budget, we have money in the professional services account for contract workers, and this resolution allows us to fill those positions.
Is it 3 or 2?
Yeah,
It's-
it is.
Well, it's I guess it's like 2 therapists and a prescriber, so it ends up being 3. I think it could change based on what the new DCS wants to do. I mean, you know, they could add hours on the prescriber side. You have to come back and talk to you anyways, because you still got to approve the contract still has to come through anyways.
Oh, so now I'm totally confused. This isn't 2, the title is 2 mental health.
I think you raised that with me today. Yeah, we might have to,
You might have to come.
yeah,
up with a
it's
prescriber
2 contract therapists and one contract prescriber. So there are 3 contract positions. So I'll tighten that up if it needs to be. I don't know, does it need to
Definitely.
have some change there? Yeah, that's, we don't, we just don't have most of the people who wrote the resolution for the department aren't there anymore. So the folks that are new now are sort of learning how to do it.
So this needs to be amended to reflect 2 therapists and 1 part-time prescriber, which
Yeah.
are the 2,
We can do
3
that.
things that were put in your 2022 budget.
Yeah.
Yeah, could you make that?
Yeah, please just send me some language, Rich. Oh, you? Good. All right.
I do recall the 22 budget.
Yep.
Because of the increase in volume.
Mhm.
There was a part-time prescriber you were going to try to bring out under contract and 2 contract
2
therapists.
contract therapists, yeah.
So yeah, this resolution should be cleaned up.
Yep, so it's
Okay.
budgeted stuff. So you can pass it as amended, I guess, or put it out there as.
I don't know, what do you want me to do, Rich? Just,
Well, you haven't put it on the floor yet.
right,
So you can make the change. And have,
okay.
So
So,
it'll be the last resolve, you're gonna change it to read the authorizing the contracts for 2 full-time therapists,
Well, not, because they're not full-time, they're part-time.
2 contract,
2 part-time therapists, and 1 part-time prescriber.
That's the deal.
all under contract. Yep, all right. Can I get a motion for that amended HH 14?
Move it.
Second? Any questions? All right.
What are the associated costs for this? And you said that they were in the budget?
So the cost for all 3 of the positions are about, as Carol was the other day, it's about $170,000. And then they earn therapists. So therapists earn twice what their salary and fringe is. So that salary and fringe for a therapist is about $75,000. They earn $170,000 a year. Prescribers.
In billable
And
services.
billable services, right? So the department pays for itself, pays for the staff that way. Prescribers return probably 1 1/3. So part of the reason to get the contract workers is 1, we need the help, but 2, they also pay their way and generate additional revenue for the department.
I heard you say it was part of the budget.
Yeah, it's in the budget, yep.
Thank you.
We lost where we are. Did we get a motion in a second? We did. All in favor?
We need to move it as amended.
I thought I did in the
Oh.
beginning. Yep. So, all in favor for the amended resolution? Any opposed? All right, great.
16.
Yep.
So we currently have a contract with Liberty Resources to provide peer-supported adult crisis respite. So 100% mental health state aid money. There's no county dollars into it. This just is to do the contract again, renew it. They operated. So the history of this is that they were going to open it. COVID happened. Everything sort of went on hold. That money sort of hung out for a little while. And then last year, things seemed to be loosened up a little bit. They thought they could open it and they did. And so now that the contract needs to be renewed. They can have up to 3 people at a time. So it's really helpful for us.
Okay, why don't you go through 17 and 18, and then we'll put those together, group those together.
Okay.
Why don't you go through all of them, and then we'll group them together, and then you can ask questions.
Okay. So that's 16, 17. Oasis is making about, so Oasis in the past gave like $60,000 in jail state aid. And that state aid goes to Chad to put a therapist and a peer person in the jail. Medication assisted treatment is now a requirement in jails, and Oasis made money available to all the counties. We have about $100,000 that's going to be available to Cayuga County in this calendar year. So this lets us accept the money. The money is going to be typically used for, so we still have to sit with the jail staff and the behavioral health staff from the county to figure out like exactly how it works. That'll happen probably after I go. Some of the folks at the clinic are putting together some information that could be helpful. The plan that went into Oasis is to, because the counties, Dave knows this, the county has to pay for medication in the jail. So that's an expense that counties have. So this money will go to pay for whatever the medication needs are for the year. Suboxone, it can add up. I mean, I don't think they're overly expensive, but you can definitely pick up the cost that the county would typically incur. And then whatever's left over can offset the staff cost that the mental health incurs by doing behavioral health services in the jail. It's about $180,000, $200,000 a year. The rest of that money could go to sort of, underwrite that expense. And then the actual nuts and bolts of how it works really has to sort of get worked out, because I think for jails, you'll be bringing in controlled substances, which is something that doesn't happen in jails. Buprenorphine is a controlled substance, methadone is a controlled substance, and so now that there's a lot of work to get done to figure out exactly how the thing's going to work. And I imagine once they approve the plan, that work can start. So.
Right.
Are we going to talk about the email? No. Go ahead, Brian.
No, you go ahead.
All right. You and I have talked about the fact that obviously any program that goes into effect at the sheriff's department would be worked out between the mental health department and the sheriff's department in terms of the plan and how it would function.
It's a secure facility.
Yes, but I mean, this plan is going to be collaborated and agreed
Yeah, these
upon.
guys will figure out how to do it.
Right. And,
It wasn't required to submit. There's
The-
nothing to submit, like specifically what the local implementation plan looks like.
So this allows the mental health department to accept the $100,000
Mhm.
to offset the cost of the required program. And if there's an appetite by the committee, we can certainly add it and let it further resolve that the mental health and the sheriff's department will collaborate and agree on the design of such a program. I mean, that's what's going to happen anyway.
It has to happen that way. Definitely.
Have you talked to the sheriff already?
I think he knows that the plan went in, and I was looking back, because Elaine told me about this, I was looking back at my emails, I sent something a few weeks ago saying that the plan was submitted, and to sort of let me know who you wanted to have participate from your staff and in the planning, so I'll talk to him about it again.
It's just been sitting there waiting for the plan to be approved. And actually, I was leaving that for the new DCS to sort of work out, actually.
Would it be okay if we table this until the discussion has been had with the sheriff's office?
Well, to your point, Lydia, I was thinking that perhaps we could just amend the resolution and add and let it be further resolved that the mental health and the sheriff's department would collaborate and agree on the plan for such a plan and the design for this program, something to that effect. So it's clear, crystal clear. I think the sheriff and he's on right now is, when we spoke, said, yes, that this has to be implemented in the jail. This is $100,000 the county can use to offset the program implementation. And if the issue is that, obviously no program can go out into the jail that the sheriff doesn't agree. I mean,
No, I
there
know,
has to
right,
be
yeah.
a
It's kind of a weird
collaboration.
conversation, but sure, yeah, I mean,
So, instead of tabling this, we can get the money in.
you want to accept the money, I mean,
Yes, and then just add the additional language that the design of the program would be.
Is there a deadline for accepting the grant?
so I already set the stuff in Oasis, yeah, you had to let them know last year what you're gonna do with it and when you're gonna expend it, so like we could have taken the money like at the end of 2021, like in the last quarter, but that didn't make sense, just take $100,000 that we wouldn't be able to spend on the program, because it'll take longer to put it together than that, so bumped it to 2022, so now you got the full year because it's gonna take, it'll take a couple of months to work out how it's gonna work. I mean, it's working in the jail. There's a lot of, it's a complicated environment to work in. I mean, we always have to figure out, what that looks like and all that. So yeah, that's pushed it into this year for that reason. There was no way it was gonna get done in the fourth quarter of 2021.
Ray, what is the impact of this decision in a macro view when it comes to the sheriff and how they operate once this decision is made? I'm almost agreeing with Lydia, we might have to table this, like.
Well, you can table it if you want. I mean, you guys can do whatever you want. I just don't understand. Like, I didn't see the email. I don't understand the confusion or the politics of some of this stuff, but I don't have to.
I don't think
worry
it's
about it anymore either.
questions. I mean, I'm just asking questions. I just.
I'm just answering it, yeah.
Yeah.
Table it if you want. It's a routine thing. Add the language if you want. It's redundant too. I don't know how it could happen without working with the jail staff.
There's a motion to table. Okay.
I was just gonna say something before. I didn't know we were motioning to table.
Lydia made the motion to table. Mike seconded.
I'm right now, I'm on the fence. Can I hear what Legislator Nightingale
Would you
gonna
mind
say?
if she
I might
said
wanna,
something? Go
I
ahead.
just want to hear what she says in case I change my mind.
I just wanted to let people understand that this is state required program. We have no way around it. So by delaying accepting the money, we're actually delaying the process of sitting down between mental health and the sheriff to carve out what that program will look like. We don't have any option out of this. This is state required.
Question to that. So the decision-making process now, is the dollar total something that is going to be flexible once the discussion is made?
You have.
Well, the plan is to pay for the medication and the.
But this is a
staffing.
$100,000 allocation for this purpose, then you would accept all of it,
Oh, yeah.
right?
And spend it all. Sure. You'd offset the costs that you incur now, that doesn't have any reimbursement, and whatever I mean, like, so if the medication on them costing $30,000, then you'd have $70,000 to put towards the staff, and, so you just play it out that way, and it shows up on the CFO.
Exactly. So the potential medication could be paid for.
You're
by
gonna
this.
pay for the meds,
And then
definitely.
you can potentially, if you have staff from your mental health center doing some of the prescribing and some of the work.
They're
you will
already,
then-
they're there now. Yep.
You'll just get additional revenue
Right.
in the mental health department to offset some of the time they're spending there. So I think we're definitely would take.
And we
the
talked about this during the
100,000.
budget too, in terms of, because that money is in the budget allocated towards that. I mean, you would also pay for, there's urine tests that, there's labs that have to get done with folks that are put on this, that the county's on the hook for that stuff. Money would be used for that as well too. Because it's free money. Again, it's free money. You might as well, you might as well use it to save on your costs.
So if, go ahead.
So the discomfort is the fact that this needs to be parts of that with the sheriff. Is that what you're?
The plan needs to be agreed upon, I would,
Right.
yes.
I mean, I wonder if that's the objection.
Yeah, that's the only thing, just, you know, that's my only hang up, and
That's why I was thinking maybe if we could amend the resolution to just state the obvious is that the mental health department and the sheriff's department will collaborate and agree on the plan.
Isn't this resolution just to accept the funds?
It is. So we don't need an amendment, but if we want to make it clear that they're, Ray or his successor cannot just put a program in there for medicated assisted treatment without the agreement and approval of the sheriff's department as well, which obviously has to happen. That would just solidify the fact that we can accept the money and that there'll be agreement on how the program will be rolled out in the jail.
Right, is this a predetermined program?
No.
Yeah, make it up.
I think what's predetermined about it is that jails have to offer, there's three medications for medication assisted treatment. The jails have to offer it. It doesn't say how they how you identify the prisoner, right, that has the need, how the medication moves, what the nursing staff does in terms of testing, all that has to get worked out and committed to paper and all of that. Like that's where the rubber meets the road. I mean, accepting the money and allocating it across expenses, that's no big deal. It's figuring out how to make things work in the jail. Because they've got schedules too, that, they're moving people, they're in solitary, a lot of weird things are going on. So you have to really kind of negotiate all that, like on a daily basis too, like it just happens that way. Like so many things happen in jails that screw up your best laid plans.
Madam Chair, I feel that because a big part of this project has not been addressed, because the sheriff's department has not been collaborated with and plans about the allocation of funding and the process for the medication prescribing and distribution has not happened to this point. I still request we table until at least additional discussion has been made with the sheriff's department.
There's a motion to table, second. Mike? All in favor to table till next month? Yes,
I'm going to oppose.
Brian?
yeah, my first instinct is the table, but I do want to move on. And, I think that I really want to hear from the sheriff. I do, in my opinion. That's where I'm at with it. So I think I'm opposed at this point because I don't know, is there a reason why we have to make a decision today, right?
You're in support of the table, it said.
Yeah.
It seems like, yes.
Yeah.
And if that's majority, I'll table it till next month and then there can be additional conversations with the sheriff and a level of comfort. Yeah.
I was just gonna say, maybe a show of hands so we can get an actual.
Okay. Motion to table? He's not on.
Elaine, I can't see what's going on. Who is opposing the measure here?
At this point, the table is myself, Lydia, Mike, and Brian.
Okay, thank you.
Okay, so we're gonna table this till the February Health and Human Services meeting. 18.
Yes.
Yes.
So all of the sort of behavioral health organizations in the state all got money from one of the statutes that pushed a lot of money out to, battle the pandemic and stuff like that. So Cayuga County Mental Health was awarded $66,000, and that money is specific towards like retention,
staff retention, recruitment and training and all of that sort of stuff. So we had to also let mental health know whether or not we were going to accept that money by a certain date. So the nuts and bolts of working that out are pretty complicated, and it would involve, HR knows about this. We've been talking to Colleen, I don't know, the last 3 months about this, and it requires the legislature to sort of direct HR and conversations with the union if this was going to happen and all of that sort of stuff. So that's another thing that's going to take a long time to work out. But accepting the money just accepts the money and it sits in an account here. And if you can't expend it in the time that you're supposed to expend it by, OMH just recoups it. So it stays in the account and they come and take money. In the odd chance that you can get to a place where you were going to do something for the staff at mental health based on the sort of rules of how you can spend this money, that's great. If not, then they'll just recoup it and take it back. So it just sits in a reserve account until then. So I told them we would accept the money. And then, this will be something that either will get worked out or not worked out in the coming months. And then if it gets spent, great. Some of it gets spent, not all of it, that's great. OMH will just take back what wasn't spent. It's 100% dollars, doesn't cost the county anything. So it's just a resolution, accept the money, doesn't commit to a plan, doesn't commit to anything. That's a lot of work to bring the union in and do all of that sort of stuff. So I think HR will be taking the lead on that, my guess would be.
And in the last resolve, it certainly says that the allocation and expenditure of such funds would be subject to further county review.
Exactly. Yeah, you'll be, they'll take some time to work through this, and you have to see whether you have an appetite to do it as well too. So, but somebody else's gig, really, I think, outside of the department to make that happen.
Can I get a motion for HH? Okay, second? On favor? Or do you have a question, Trish?
I did have a question. Is this money specifically for county employees or could it be used for workforce development? within the
Just county mental health. This money, so anybody in behavioral health, so probably Unity House, Cayuga Counseling Services, all the behavioral health providers, Chad, places like that, they would have gotten, like, we didn't apply for it. They just sent you an email saying, here's your share. Yeah, so I think it got spread around to all of the licensed agencies in the state, probably in the country, my guess is.
Okay. All right, in favor of accepting the funds, and then we'll get a second look at they get spent and how they're spent.
Yep.
Yep. All right.
Aye.
Any opposed? Last but not least.
So the person who's in the supervising social worker position is the subject of your executive session today. And if that ends up happening, then that'll be a vacancy, and we're looking to fill that vacancy, pending if you do that.
Right.
So I figured I'd get it on for her.
That's why it reads anticipated opening.
It's an anticipated opening, yes.
Okay. And this is a key supervising social
It's
worker position.
budgeted and it's filled, and
Okay.
but that won't be on the 28th.
Motion for HH 19, permission to fill supervising social worker in mental health. Second?
Should we word this in case the backfill is required based on the executive session?
Well, it does say anticipated opening, so if we don't move forward with that, then it's not open, right?
Yeah, so the thing I learned is that on appointed positions, you can't backfill. So normally you would have in the, promote this person and then backfill the vacancy, but it's an appointment, so you can't do that. So I didn't know that. It's just something to learn.
Okay, all in favor? Any opposed? All right. Does someone make a motion going to
Wait a
executive?
minute, no, it's a
Oh, sorry.
medical crisis,
Oh, I'm sorry. Oh, yeah, sorry. Go ahead.
so you're not done with that.
Was that 19?
There's no resolution for that. That we just passed 19.
Okay, we just passed that.
Yeah. So that first resolution that you passed, that the state aid, the regional state aid that pays for mobile crisis. Mobile crisis in the region that's paid for by the state aid
operates 5 o'clock at night to midnight during the week, and then 6 o'clock in the morning to midnight, holidays and weekends. Back in early 2021, I don't remember exactly when, but it was pretty early in 2021, Governor Cuomo, he made an executive order directing police agencies to engage in this process where they were supposed to identify things that they were supposed to do around their training and resources that they need to, handle the kind of calls that typically police, they're not in the best position to answer them, right? So mental health crises and check the welfare cases are a lot of the things that mobile crisis does. So the law enforcement agencies in the county talked about wanting mobile crisis to be available 24 hours, 7 days a week, overnight. The regional state aid can't pay for that. Regional state aid is just enough for those hours that I told you, but also, restricted access to it. So we've been talking about this for a little while, the sheriff and the chief of police in Auburn and, a bunch of other people. And, the ARPA money is available. So Liberty Resources is the provider of mobile crisis services in the county. They coming in, so for them to go from, so there's two parts to this. So these ARPA proposals that you heard tonight, the foster care sort of incentives, and this one for the daytime mobile crisis teams, joint responses, were put in back with the ARPA requests were asked for from department heads and whoever else back in June. So these things have been sitting out there and now they're, sort of talking about them a little bit tonight, obviously. Brian's on the line and he's going to be talking to the Public Safety Committee about this as well too, because, this is something that we feel very strongly about. And we think that there's a way to get this done that's going to deliver to the police and to the community sort of resources that they need. So it's interesting stories are important. I've been coming up here for the past bunch of months talking about, how the mental health system is like really bursting at the seams. Overdose deaths, suicides, crazy stuff that's going on. It's really, we've never been this busy and we've never seen the acuity that we see. We had a guy got dropped off to the clinic Friday. He'd soaked himself in gasoline. He tried to let himself on fire. So somebody took the mattress away from him, dropped him off and left. So he came into the clinic because that's where they take people. So that seems maybe strange to hear that, but that stuff happens more than you would think. And the police go out on those calls. And, they're not really equipped to sort of, and shouldn't have to deal with folks who are in that kind of acute, distress. So they use mobile crisis currently right now. They use it quite a bit. And they get a good response from Liberty. And they divert a lot of people from the hospital because when police take people to the hospital, they got to take 2 cars off the road and they got to go sit there for 3 or 4 hours in the emergency room waiting for people to get admitted or at least evaluated. Hospitals are pretty overrun. They don't want these folks in the emergency room. It's a little risky. So had a discussion about making this thing 24 hours, 7 days a week to support the police. And I think the purpose of our proposals, the two teams, the DSS mental health teams, was really to support, one for kids and one for adults, really to have a lot of support in the school district. And, they've needed it. They're having a hell of a time and there's all kinds of stuff going on there. So we thought we were talking about this. And when I think about mobile crisis, when I always think about things just like that business about contracting, taking that money into the preventive contract for the foster care home finders and stuff like that. You always got to figure out how to way to fit things together in a way that makes the most sense and is the most sustainable. So this is the conversations that we've been having. Liberty Resources can go 24/7, would have teams available overnight for the police to respond to, be about $200,000 in ARPA funds. They bill Medicaid. So maybe there's some Medicaid revenue on that. So they made some projections on that. It's always that's a tough one to hit because we do the Medicaid revenue reconciliation on the mobile crisis during the day. You stop me if you have a question, please, because I know this is a lot. It really is. Don't feel bad about it. Coming in late to the game in general, what I mean, with this stuff we've been talking about for a long time. So using the ARPA money to fund Liberty would give the capability for the police to call and get that response on those overnight shifts, which they think is really important for the work that they do. And, you know, we support that. We want to move as many people out of law enforcement contact when they're in a behavioral health crisis, get them what they need and where they need, and let those folks stay on the road and do what they do, which is keep us safe and investigate crimes and all of that sort of stuff. During the day part, I'd like to use some ARPA funds, about $85,000 to seed the beginning of a team between Department of Social Services with an adult protective services worker and a therapist to go respond to adult cases, because that's what we're doing now. Like, we get these calls and we scramble to find people to go out, and we go out. And then one with a child welfare worker and a social worker for kids. And they would be able to respond with the police. Right now, they bring them to the clinic. So a lot of the times when when police respond to behavioral crisis in the community, they'll transport people right to the clinic and drop them off, and we'll see them and we'll assess them, and we'll try to safety plan. And we keep probably 90% of those cases don't go to the hospital, and the cops are right back out on the road. That's a much more sustainable model for us because we can bill. We get the preventive 62%, and then we get a very good Medicaid rate. Like, there's a special Medicaid rate for crisis services that's turned on for Liberty Resources and County Mental Health. So we would be able to sustain those groups at you know, outside of the initial investment pretty quickly. Liberty is going to bill Medicaid, and you know, that's the only billing that they can do. They can't do commercial billing yet. They're not on Article 31. I think that one day they're going to open those rates up, but that's a negotiation. So a little under $300,000, you would get a significant upgrade to that particular program. We also have some additional money we want to open up to the community so people can call directly, so that they don't have to call law enforcement, and eventually over a few years, maybe take 35–40% of those cases out of that call volume and just have strictly a mental health response, which would be a great long-term plan. So we've talked about this, and I know Brian's on, and I was just going to mention this to you guys tonight, you know, and then answer any questions that you have them. He's going to talk to public safety, which is what, next Wednesday?
This one.
This tomorrow then, and then, you know, if there's an appetite, you know, we would bring a joint resolution to Ways and Means to use the ARPA money. It's not a lot of money. It's not a lot of money for this particular service and what it's going to do for law enforcement and what it's going to do for people in the community experiencing acute mental health crises, or you have people locked in there. Usually some of you guys might hear these stories, but it's pretty bad out there. And it's be sort of a good way to do it. So that's kind of like it's a lot of information, and I'm sorry that it comes out that way, but I'm happy to take as much time as we need to talk about this stuff.
I don't disagree that this is very important, and I work in the high school. I see
Okay.
things regularly. But I guess what my mind is struggling to understand is, how is this going to be a one-time cost for ARPA funds? Like, wouldn't this, you know, go on? Like, these are services that aren't going to end at the time the ARPA funds run out.
So so part of the thing that we always like to think about is, you know, sustainability of the stuff that we do. Because what's the point of doing one-offs? It's, you know, a lot of grants are like that. People get grants and they're one-offs and there's no sustainability to them, and it really doesn't move the needle. So for the teams the during the day teams, the sustainability is in the one-time funds is to get it going, because when you don't have any business, you're not billing anything yet. So you're going to take a little bit of time to get the thing embedded, get people trained, get it embedded, and get it used. During the day, I don't think you have an issue with volume, because we know what the volume is right now. We get a ton of calls. A lot of people get brought to the clinic. We're doing 15 to 20 crisis walk-in, drop-off visits a day, every single day. So those numbers are there. We get unique and special rates for doing this work, so we bill. So like what I was saying earlier, a therapist bills, they get twice their salary and fringe. So there's how that's sustained. That was easy. So if the mobile crisis one, it's hard to tell. You got to look at sort of the utilization on the overnight hours, right? How many people are going to call? How many are going to go out? But I think that, so there's the initial way to look at it is there enough business during those hours to generate the revenue to sustain it, right? I think
in part of the contract management of this thing, so like when we were talking about earlier, who tracks these contracts for Liberty Resources and make sure that the, the money and all that sort of stuff. So they come to the Central New York Directors Planning Group. And the challenge with this particular project in general is overall across the 5 counties, you have this state aid that funds the 5 to midnight thing, right? Like I was saying, but you also have in Onondaga County, there's a SAMHSA grant that funds 24 hours, 7 days a week. In Oswego County, you have a CCBHC grant, doesn't matter what those things mean, that funds 24/7 too. So you got to blend that money into the contract, and we have to manage it. So you have to make sure that their expenses are aligning with the fallout. But there's also going to be a time where they're going to generate enough Medicaid revenue. This is where the contract management and oversight comes in, and working with OMH on those budgets to make sure that that Medicaid revenue that's generated sustains the whole program and can't be compartmentalized. And then you talk about how you're going to sort of from a staffing perspective and all of that sort of stuff. So I think it's doable. I think it's going to be okay. I think that, Liberty's going to need some help to get there, because this is all really pretty much kind of cutting edge sort of stuff to blend money this way. So you got to do a lot of reconciliation on the Medicaid billing and the Medicaid payments and all that sort of stuff. Just trying to give you a sort of sense of, it's doable. It's happening right now. There's enough. They generate more and more Medicaid revenue every year to sustain the expansion. Because like when mobile crisis, when you do it, the call outs increase every year because police get more familiar with it. You know what I mean? People get familiar with it and they call. So the volume goes up, but their revenue has been static from the state aid perspective. The revenue that they generate from Medicaid allows them to handle the expansion. So that's going to continue. And I think you can get by with a one-time expense.
Okay, so then I think I have really kind of 2 follow-up questions to that. Could we possibly see that data and see how that would actually work? And
What data are you looking for?
well, that if you're saying that we're getting this much, we'd be able to get this much Medicaid, this many call out, so that we could see how that revenue is being generated. And then second, is any other county doing something similar to this, so we can maybe have a comparison and see how it works for them?
Quite a few counties have used ARPA monies to enhance their mental health services, and some cities have, they're funding this expansion in other places throughout the state. Yeah. Based on the plans that the police submitted, mobile crisis isn't everywhere. So it's to start it someplace or to enhance it, to do this sort of stuff to meet the needs. So a lot of people are on that, are doing that now. And I just, the only thing that's really that has to be kind of figured out is, what's going to be the volume of the calls, and you won't really know until you start getting calls to do it. So I can tell you you can do projections on the rates. We can say, this many call outs results, because the rates for mobile crisis are different than the rates for like outpatient therapy. So if you see a patient, see him for 45 minutes, you bill that rate, you get paid. With mobile crisis, you get a window of time where several services can be, on that one instant, you can have several billable services. So the phone call is billable, the visit is billable, follow-up phone calls, follow-up visits are all billable under the same rate structure, which is different. So that's been really helpful, because a lot of the work is outside of the actual visit.
Really? And then Mark? I have a question. So I served on the Police Reinvention Collaborative.
I'm sorry.
I served on the Police Reinvention
Right.
Collaborative, right? So it was determined APD and our sheriff's department would benefit from.
It's in our
mobile
plan.
crisis.
Yeah.
Is the city gonna put up any ARPA funding for this effort, since the city police would be benefiting from 24/7?
I think we're talking to them. I think they're interested in this happening. I do think it's a county's program, this is my opinion. It's not a lot of money. I don't know, maybe
It's just, yeah, I mean, it puts me in a tough spot to talk about what the city's thinking. I think that they'd like this to happen.
Yeah, I didn't know if there's any conversation.
Yeah, I mean,
There was.
so we've been doing this joint planning with the sheriff and the police chief and city folks, you know, try to make this happen as well too.
Lydia?
And this is utilized countywide, correct?
Countywide.
Not just.
Yep.
Thank you.
Okay, Mark, go ahead.
And just a quick comment, and actually, Wayne actually answered or asked my same question. Number one, this is from what I know of this program, it's a part-time service at the moment. You're trying to make it a full-time service. What I know of it, it's been a very successful program.
Yeah.
And basically what you're asking is for startup money.
Yep. One time.
And again, to just piggyback on Aileen's comment, you know, if this, and I know this is used in the city, I hope that the city would be willing to, you know, spend or match whatever the county puts in. I hope the city, you know, would, you know, do the same.
Yeah. So I just think about the $250,000 that you guys committed to the study for the shelter. Like, I think that, you know, the city has some interest in that. It's a lot easier for the city to talk about participating when the county steps forward first. So I think that I think if the county was to make a commitment to fund this, or at least move the discussion to ways and means, I think, Hans, is what the sheriff and I talked about, was have this discussion at the two, you know, at Public Works and here, there was an appetite, bring a resolution to ways and means, you know, talk to you, bring a resolution to ways and means, and because there's an interest in getting it done as quick as possible, because it's still going to take a couple of months. Once the money moves, you got to hire people, train them, do all that good stuff. I think that if that commitment is made, it's a lot easier to go back to the city and say, you know, in fairness, you guys want to kick in a little bit and then reduce that out. I think it makes it easier for them to say that, you know what I mean?
If I'm understood what you said, that you're looking at it potentially $200,000.
About 280 altogether, yep.
And 80 for the startup
For during the day.
for the staffing.
And I'm going to kick in $80,000 of healing money to open it up to the community so everybody can call.
But the 200,000 for Liberty moves them from 4 o'clock or 5 o'clock in the afternoon until
Yep.
the morning.
Overnight.
And that 200,000, yes, you have to evaluate the call volume and how
Yes.
the billing, but how long do you anticipate that $200,000 investment keeping this mobile team in operation? Is it a year? Is it a year and a half? Is it?
So it's an annual budget. That's an annual ask. You know, that's what they're talking about for the first year. I think that you'd wanna.
So after
So-
1 year, but after 1 year, there would be, the ARPA would be exhausted and we have to reevaluate.
So I think this is where this is the business about sort of contract management and budgeting and all that sort of stuff. We're always in conversations with Liberty around, you know, there's a bunch of money coming in for this particular service from different counties. There's the state aid, like I said, other counties put money into this as well. So we're trying to want to get an accurate financial picture of what all of that looks like, right? Integrate it all into what, you know, to try to understand it. So when you ask a question like, it's very difficult to answer that because this is such a moving target to try to get a handle on the finances. I think that there's probably enough funding overall in the entire pot to sort of sustain it once it gets going. Because again, like Medicaid revenue continues to grow in the regular business time that they're already doing. And then, you know, we'll have to see how it grows here. And there's also an obligation on the part of the agency, like this is a gold mine. This is the greatest thing in the world. If you're running an agency and you have this regional mobile crisis contract, this thing can go as far as you want it to go because of how the rate structures are built and how the window of services is so wide, like the follow-up and all of that sort of stuff. Like you I mean, they are growing it too, you know, I mean, you can grow this thing to be big enough to do all of this sort of stuff, and I think too that we still talk about the rates even changing and improve, OMH is very invested in mobile crisis being available in New York State 24 hours, 7 days a week, and they're like working alongside everybody else to try to make that happen. So while this is going on, this year where you're doing this, all this other stuff is happening as well too, so you want to evaluate all that along, and then I think you'll have ongoing discussions. You're gonna get another drop of, what would you get? You're gonna get like, what, $14.7 million more in May. I think you're $2 million underspent on the ARPA funds based on everything that got put in, unless stuff has changed.
We've gotten 7, we'll get another
You're
7.
you're gonna get a lot of money. So I mean, I think that those, I wouldn't say commit to it now. I'd wait and see. I'd wait and get a look at, I think when we talked about it, it was like, let's see how it goes. And then you sort of evaluate it in an ongoing way, and you'll have that, because you'll have people paying attention to it that way.
I wonder if this is qualified for shared services.
Between the city and the county, shared service.
We should ask them maybe.
I don't know. I mean, you'd have to explore that. I don't know if
Because
it
we both wanted to
does.
put one up,
Right.
potentially,
Yeah, I don't know. I don't really know the rules about that to say.
but it is a $200,000 ask for Liberty, and it is 80
About $85,000.
and in the creation of 4 county states, really.
You know, two, there'll be, like, again, I think that's really important. So what, again, like, it's cheaper. So we also have the budget for Liberty to do during the day mobile crisis, like for them to fully do it. It's cheaper for us to do it than the budget that they gave us. And also too, it, in the way that the system is designed, those adult protective services and a clinician going out to see folks, adults and elderly adults, makes the most sense, because those cases come to the department, either one. That's going to end up being an adult protective case because that person is so impaired and needs that kind of support, and they're going to be in the clinic. So, and on the kid side, it's the same thing. It's like those kids are fast kids, and you got that connection with the services that the departments both fund together. It's just a lot smoother to be able to pull people in there, and it just makes a lot of sense system-wide to sort of build it that way, and that's kind of went into the thinking. So
Can we just clarify the ARPA funding that we received, 7 million this year, 7 next year, so it's not an additional 14. And we have-
okay, all right, well, you didn't know the drop,
We
right?
have
Okay.
The project lists that we received from all the county departments, we haven't moved on them as a body, but we can spend that in 5 seconds. You know, I mean, there's tons of things to choose from, and it's just something to consider as these things are coming up, because, you know, they're not in front of us right now, taking their case. We've all submitted plans,
Expanding mobile crisis was in the executive order, that was in the, and so was body worn cameras and
those were
some of the
the
other things,
two
yes.
goals that came out of the reinvention.
So we just met to try to figure out what was the best way to do it, and this is kind of where we landed.
And you're saying, Ray, Sheriff Schenk is going to be talking to judicial and public safety,
Kind of like this, yeah.
saying, hey, look, I'm on board with this. I think it makes sense. I think we should try it and try to convince 2 committees to give the okay for Ways and Means.
To bring a
consider it.
resolution to discuss, yeah, so I mean, we met this morning, was the last time we met. We had a meeting this morning, so. So I'm just laying that out for you guys, the thinking that we have, and I think it really is important to support the police in this work. I mean, I know what they do a really good job with these folks. They really do. We're not a place where these folks don't get taken care of. We're not a county where folks are disrespected and not treated fairly for that disability, and that's important to know. This gives them a tool to do a better job, because you have some folks calling them 40 times a month, 6 times a day to drive over to their house because they're just so, it's not doing well. You know what I mean? So it's better that we go over there, you know, the first time, not after they go 6 times, say, can you go? And then I got to go down the hall and find a preventive worker and a social worker, you know, to get together and go over the house. That might take a couple of days. This gets a more immediate response, and there's work for them to do in departments when they're not working. This is a really good deal
And if you can't find
Operationally.
people, they are transported to your clinic and they sit there and.
Then they drop, they drop them off too, you know, so they do a good job with that. Like you see, you said there, you see cop cars pull in and bring people in, they really do a really nice job. I mean, it's important to note that, I think. So that's the pitch, you know, I think Brian's gonna talk at public safety, and then Hans, if you think that it's worth a resolution, you'll let us know and we'll draft one up. And then if you want to sit and talk, anybody wants to talk some more about this, happy to sit down and flesh it out a little bit more.
Right, thank you.
Thank you, Ray.
Thank you.
6 more work days.
Yeah.
It's weird, but
I'm
good.
sure it is.
Congratulations.
Thanks.
Could I get a motion from someone to go into executive session? In regards to, okay, in regards to the employment of a particular person? Okay, great.
Max?
I don't know, do we have to leave and?
I'm here, Jody.
I'm gonna take over the screen.
Okay.
Okay, sounds good. Jody, could you just let me know who made the motion for executive session and who seconded it?
Lydia?
I thought I had Lydia for the motion. Was there a second?
Bob Shay?
Bob Shay. Thank you so much. All right, I will stop sharing my screen here, Jody. Thank you.
Yes, you guys.
All right.
She says, Eileen says.
Anyone wants to go in?
Yeah, I think we have.
All right.
Yeah.
I love it when you smile. I don't see it enough. It usually does mean something's coming. But it's coming.
Yeah, is all the way there or just me?
She said everyone. She said everyone.
Oh, everybody. Okay. Thanks, that's long. Thank you, sir.
Oh, he was that color.
Got it now.
Max, Max, are you there?
You figured we weren't doing business out there?
He's still on.
I'm still there. Okay.
He's still there. He just probably.
In the bathroom.
Max, can you hear me?
Here he is.
What else? Max, I don't have his cell phone. we were thinking that Max was controlling the mute. That is not the case. This meeting is live, so Rich will take the minutes from the action that's being recommended now. So if we came out of executive session, and I would like to present two resolutions, HH 20 and HH 21. HH 20 is to appoint the Director of Community Services in the Mental Health Department, DCS, in oversight of the clinic, and make the appointment of Lauren Walsh to the full-time position as Director of Community Service at a starting salary of $97,000. Could I get a motion for that resolution and a second?
Move it.
Okay. Lyd, okay, Lydia, and, okay, thank you very much. All in favor?
Aye.
Aye. Great. Lauren, I see you're on. Congratulations. But we do have to bring this, you did bring this forward to Ways and Means, and it will be subject to a full vote of the, at the end of the month. HH 21 would be to appoint the Commissioner of Social Services. And the recommendation is to hereby appoint Christine Bianco to the full-time position of Commissioner of Social Services for a 5-year term commencing January 28th, 2022, and continuing through January 28th of 2027 at a salary of $106,157. Can I get a motion for HH 21?
Move it.
Second,
Second.
all in favor?
Aye.
Aye. No one opposed? Great, congratulations. Okay, and I guess we can get a
Motion to adjourn?
Second.
All right, thank you.
We'll never get any.
Thanks.